Okay, today we're going to do reflexes. So, hi, I'm student clinician John. What is your name?
Perry.
Nice to meet you, Perry.
Nice to meet you.
Today we're going to be performing a couple reflex tests. If anything I do makes you uncomfortable, please let me know. And if you have any questions, please don't hesitate to ask. May I begin?
Yep.
This is a Taylor reflex hammer. It's used to test reflexes.
Okay.
It should feel like this. Is that okay?
Yes.
Perfect. First, we're going to do the jaw jerk reflex. So I'm going to have you close your eyes. I'm going to place my hand on your chin. Is that okay?
Yep.
All right. I'm going to have you open your mouth and relax. Okay. And that is testing the trigeminal nerve. Next, we're going to do the biceps tendon. And while I'm doing this, I'm going to have you lock your ankles just like that. I'm going to have you close your eyes. Flex your arm for me. All right, and relax. Now relax, close your eyes, and try to pull your feet apart for me. Try to pull these apart, like this. Yeah, there you go. Okay. All right. Same on this side, and have you flex. All right. And do the same thing with your feet, please. Okay. That is testing C5, the musculocutaneous nerve. C5 and the musculocutaneous nerve. Next, we're going to do the brachioradialis. This is testing C6 and the radial nerve. So I'm going to find the brachioradialis. Heavy flex, please. Perfect. And I'm going to have you close your eyes. Okay. Same thing on this arm. Have you flex. All right, and close your eyes. Okay. Next, I'm going to do the tricep, testing C7, the radial nerve. So, have you push out on my hand. All right, perfect. I'm gonna have you relax and close your eyes. Okay. Same on this side. Have you push out on my arm. All right. Maybe close your eyes. Okay. Next, we're going to do the patellar reflex. Usually, I would have the patient wearing shorts, but she doesn't have shorts. So, for this one, I'm going to have you take your hands and go like this and try to pull apart when I'm doing the reflex. So I'm going to have you close your eyes and now try to pull apart. Okay. Same on this one. Maybe close your eyes and try to pull your hands apart. Right. And then that is testing L4, the femoral nerve. Next, I'm going to do the Achilles reflex. I'm going to have you lie down, face down, please. Put this leg up. Okay. Now maybe close your eyes. All right. Same on this one. You close your eyes. Okay. All right. Now next, we're going to do some visceral reflexes. So I'm going to use this flashlight. All right, we're going to do the pupillary reflex. So I'm going to take this light and shine it into your eye, looking for the ipsilateral pupil constriction. The integrating center for this is the midbrain, and sensory is cranial nerve 2, motor is cranial nerve 3. So I'm going to have you open your eyes. Okay. Perfect. Perfect. Next, we're going to do indirect light reflex. So I'm going to shine the light in your right eye and watch your left eye. The expected response is contralateral pupil constriction, testing cranial nerve 2 for sensory, cranial nerve 3 for motor. And the integration center is the midbrain. Okay, so I'm gonna have you open your eyes. Okay. Next, we're going to do the accommodation reflex. So I'm going to take this pen and move it toward your eyes, and you're going to watch it the whole time. Okay. The eyes will converge and the pupils will constrict. This is testing cranial nerve 2 and cranial nerve 3. Integration center for this is in the occipital lobe. Next, we're going to do the oculocardiac reflex. So I'm going to take this, and then I'm going to have you close your eyes, and I'm going to press lightly here. Okay. And we're going to do this side. Feel radial pulse. Okay. So the pulse should decrease. This is testing cranial nerve 5 for sensory and cranial nerve 10 for motor, and the integrating center is in the medulla. Next, we're going to do the carotid sinus reflex. I'm going to feel the radial pulse again. And then can you move your hair back? Okay. And then I'm going to press on the carotid sinus. Okay. Same thing on this side. Okay. Pulse should decrease for this test. Cranial nerve 9 is sensory, cranial nerve 10 is the motor, and the integrating center is the medulla. Now we're going to do the ciliospinal reflex. So I'm going to pinch the base of the neck. Maybe open your eyes. Okay. Okay. And normal response is pupillary dilation. Okay. Next, we're going to be doing some superficial reflexes. So the first one is the gag reflex. I'm not going to perform this, but what I would do is take a tongue depressor and touch the back of your throat. That will make you gag. This is testing cranial nerve 9 for sensory and cranial nerve 10 for motor, and the integration center is in the medulla. Next, I'm going to do the interscapular reflex. I'm going to swing your legs over there. Need to find something to brush. Makeup brush. Yeah. So we're going to take the brush and lightly stroke between the scapula and the spine, following the course of the rhomboid muscles. So. Okay. And next, we're going to perform, that's testing sensory is T2 to T7 for spinal nerves, and motor is the dorsal scapular nerve. The integrating center is T2 to T2 to T7 spinal cord. Next, we're going to do the abdominal reflex. So I'm going to have you lie down on your back, please. Okay, and I'm going to have you move your waistband down a little bit, please. Perfect. So we're going to lightly stroke toward the umbilicus with the brush in 4 spots. So we go that, 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 and that. Okay. Sensory for this is the upper ones are T7 to T10. The lower is T11 to T12, and that's same for motor. Upper is T7 to T10, lower is T11 to T12. And the integrating center is T7 to T12, spinal cord. Next, we're going to do the plantar reflex. This is going to tickle probably. So I'm going to drag the bottom of the hammer from the heel to the big toe in a curved manner, looking for the toes to move down. Okay. Move this here. Okay. My patient is very ticklish, but we're gonna try. She can't do it. I think her sensory's okay. All right, the toes move down. Sorry, Dr. Amos. Sensory and motor for this test are the tibial nerve, and the integrating center is S1 to S2 spinal cord. So next, we're going to do the pathological reflex. We're going to perform the Babinski response. So it's going to be the same thing. I'm taking this and dragging from the heel to the forefoot. My patient can't exactly. Well, I would drag from here to the forefoot. An abnormal response for this test would be dorsiflexion of the big toe and fanning or slaying of other toes upon stimulation of the plantar surface of the foot. And that's going to be the same response for these next four reflexes. The first one, we're going to do the Schaefer reflex. So I'm going to squeeze the Achilles tendon. Squeeze. And two. Squeeze. Okay. The next one is the Gordon reflex. I'm going to have you move down the table a little bit. There you go, perfect. Okay, I'm going to squeeze the calf and squeeze the calf. And then next is the Chaddock reflex. To drag the hammer. You can move back on the table. Okay, so we're going to drag the hammer from here to here. And same on this one. Okay, and then the last one is the Oppenheim reflex. So we're going to drag the hammer down here and here. Okay. Next, we're going to do the ankle clonus reflex. So I'm going to push the foot into dorsiflexion and then let go. Push the foot into dorsiflexion and let go. Push the foot into dorsiflexion and let go. All right, an abnormal response for this would be continued involuntary contraction of the foot. So next, we're going to do Hoffman's reflex. So I'm going to have you sit up and face that way, please. I'm going to take this finger. You can relax these fingers. I'm going to take this finger. I'm going to flick. Okay. On this hand, relax your fingers. And I'm going to flick. The distal interphalangeal joint of the distal interphalange of the middle finger. An abnormal response for this is flexion and adduction of the thumb with flexion of the fingers That would indicate an upper motor neuron lesion in the cervical cord or brain. Next, we're going to do Tromner's reflex. Tap the middle 3 digits. Okay. Same on this hand. Tap the middle palmar surface of the middle 3 digits. Middle 3 fingers. And an abnormal response for this would be flexion of the fingers and thumb upon tapping the palmar surface of the middle 3 fingers.
Thank you.